Visual snow syndrome: causes, symptoms, and treatment. Visual snow syndrome is a condition that is characterized by the presence of persistent visual snow or static in your field of vision. It is often described as looking like television static or the snow on a television screen when it is tuned to an empty channel. The visual snow may appear in one or both eyes and can be present all the time, or it may come and go. It is usually accompanied by other visual abnormalities, such as light sensitivity, floaters, and blurriness. It is a rare condition that affects both men and women of all ages, but is most commonly seen in young adults. The exact cause of VSS is unknown, but it is thought to be associated with a dysfunction of the visual cortex of the brain. The symptoms of VSS can be very bothersome and can negatively impact a person's quality of life. There is no known cure for visual snow syndrome, but there are treatments that can help relieve the symptoms. In this video, we will discuss the causes, symptoms, and treatments of visual snow syndrome. So watch till the end. And if you haven't liked the video yet, be sure to like it and subscribe to our channel so you don't miss any further videos. The exact cause of visual snow syndrome is still unknown, but several theories have been proposed. Sensory disruption. A new study has found that sensory disruptions are the cause of visual snow syndrome. This condition is characterized by the appearance of static or snowy images in the field of vision. The study found that these disruptions can occur in the brain's visual cortex, causing visual snow syndrome. This is a significant finding, as it provides new insight into the cause of this condition. It also opens up new possibilities for treatment. If we can identify the causes of the sensory disruptions, we may be able to develop treatments that can help people with visual snow syndrome. Psychophysical. One theory is that it is caused by a dysfunction in the psychophysical system. This theory is based on the fact that many people with visual snow syndrome report a history of trauma or stress. Neurological. Some scientists believe that visual snow syndrome is caused by neurological problems. This theory is based on the fact that many people with visual snow syndrome also have migraines, which are known to be caused by neurological problems. Other scientists believe that visual snow syndrome is caused by problems with the visual system. This theory is based on the fact that people with visual snow syndrome often have other problems with their vision, such as light sensitivity and poor night vision. Cerebral cortex. There is another theory that visual snow syndrome is caused by the cerebral cortex. The cortex is the outermost layer of the brain and is responsible for processing information from the senses. This theory is based on the observation that people with visual snow syndrome often have other conditions that are associated with the cortex, such as migraine, anxiety, and depression. While this theory is not as well supported as the one involving the pineal gland, it is still a possible explanation for the condition. More research is needed to confirm or refute this theory. Genetic. One theory is that it is caused by a genetic mutation. This theory is supported by the fact that the condition often runs in families. Abnormal blood flow in the brain. Another theory is that abnormal blood flow in the brain is to blame. This theory is based on the fact that people with visual snow syndrome often have other conditions that are associated with abnormal blood flow, such as migraines and anxiety disorders. While the cause of visual snow syndrome is still unknown, this theory provides a possible explanation for the condition. If further research supports this theory, it could lead to new treatments for visual snow syndrome. Symptoms of visual snow syndrome. The most common symptom of visual snow syndrome is the presence of snow-like specks in a person's vision. These specks can be present all the time, or they may come and go. They may be white, black, or any color. In addition to the snow-like specks, people with visual snow syndrome may also experience other visual problems, such as blurred vision. Blurred vision is a common symptom of visual snow syndrome, a condition that affects the visual system. Visual snow syndrome is characterized by the presence of white or black dots in the field of vision. These dots can be static or moving, and they may be accompanied by other symptoms such as floaters, visual snow, and tinnitus. Visual snow syndrome is a relatively rare condition, and its exact cause is unknown. However, it is thought to be linked to an overstimulation of the visual system. This may be due to a dysfunction in the way that the brain processes visual information. Treatment for visual snow syndrome is typically symptomatic, meaning that it focuses on relieving the symptoms rather than curing the condition. Tunnel vision. Tunnel vision is a symptom of visual snow syndrome. It is characterized by a narrowed field of vision and is often accompanied by other visual symptoms such as floaters and light sensitivity. Tunnel vision can be a debilitating symptom, making it difficult to read, drive, or even walk. If you think you may have visual snow syndrome, it is important to see a doctor for a proper diagnosis. There is no cure for visual snow syndrome, but there are treatments that can help you improve your symptoms. If you have visual snow syndrome, the best thing you can do is try to manage your symptoms and live a normal, healthy life. Floaters. Floaters are small, dark, and often irregularly shaped spots that seem to float in your field of vision. They are tiny clumps of gel or cells that have become detached from the eyeball's retina or underlying tissue. Floaters are common and usually harmless, but they can sometimes be a symptom of a serious eye condition. One condition that floaters can be a symptom of is visual snow syndrome. Visual snow syndrome is a rare condition that causes people to see constant visual static or snow in their field of vision. This visual noise can be extremely bothersome and can make it difficult to see clearly. In some cases, people with visual snow syndrome also have floaters. If you have floaters and are also experiencing visual snow, it's important to see an eye doctor for a proper diagnosis. Whole body visual disturbances. Whole body visual disturbances are a symptom of visual snow syndrome, a disorder that affects the visual system. The disorder is characterized by the perception of flashing lights and geometric patterns in the field of vision. The disorder can also cause other symptoms such as tinnitus, migraine headaches, and neck pain. If you are experiencing any of these symptoms, it is important to consult with a medical professional to rule out other possible causes. Treatments of visual snow syndrome. Visual snow syndrome is a relatively rare condition, and there is no known cure. However, some treatments can help lessen the symptoms. Some common treatments for visual snow syndrome include avoiding bright lights. One such treatment is avoiding bright lights. This can be difficult to do, but it is important to try to avoid any kind of light that may aggravate your condition. You may also want to try wearing sunglasses or other eye protection when you are outside. Managing stress. One of the most effective treatments is stress management. Stress can trigger or worsen symptoms of visual snow syndrome, so by managing stress, you can help lessen the frequency and severity of your symptoms. There are a variety of different stress management techniques that you can try. Some popular methods include yoga, meditation, and deep breathing exercises. Find the method that works best for you and stick with it. With regular practice, you can help minimize the impact of visual snow syndrome on your life. Taking certain medications. It has been found that taking certain medications can help to improve the symptoms of visual snow syndrome. The most common medication that is used to treat visual snow syndrome is clonazepam, which is a type of anti-anxiety medication. Other medications that are effective include gabapentin, topiramate, and carbamazepine. If you are suffering from visual snow syndrome, it is important you speak with your doctor about the best treatment option for you. Nutritional supplements. Some people have found relief from symptoms through the use of nutritional supplements. Specifically, supplements such as L-theanine, magnesium, and riboflavin help reduce the visual static associated with this condition. If you are considering using nutritional supplements to treat visual snow syndrome, you should talk to your doctor about the risks and benefits. Some supplements can interact with medications or have side effects, and the FDA doesn't regulate supplements in the same way it does medications. That means there is no guarantee that a supplement is safe, effective, or free from harmful side effects. You should also be aware that the long-term safety of taking any supplement is unknown. If you do decide to take a supplement, be sure to tell your doctor and pharmacist about all the supplements you take, including herbal supplements and vitamins. Seeing a therapist. If you are struggling with visual snow syndrome, you may be considering seeing a therapist. This can be a helpful step in managing your symptoms and improving your quality of life. There are a few things to keep in mind when choosing a therapist. Make sure to find someone who is experienced in treating visual snow syndrome and who you feel comfortable with. It is also important to find a therapist who uses evidence-based treatments. Therapy can be an effective treatment for visual snow syndrome, but it is important to find the right therapist for you. With the right therapist, you can manage your symptoms and improve your quality of life. There's no one-size-fits-all solution for visual snow syndrome, but with the help of a medical professional, you can find a treatment plan that works for you. Visual snow syndrome is a distressing condition that can severely impact the quality of life. While the exact cause is unknown, It is thought to be related to abnormal activity in the visual cortex. There is no cure for visual snow syndrome, but treatments are available to help manage symptoms. If you or someone you know has visual snow syndrome, share this video to raise awareness and help support those affected by this condition. If you enjoyed the video, be sure to like and subscribe to our channel so you don't miss any future videos, and share your thoughts on this in the comments section below. Thanks for watching!